With the federal election now in our rearview mirror, the attention in Ontario is quickly shifting to what's in front of us, and that is the battle against this pandemic. Tomorrow is day one of the vaccine certificate program. You'll need to show proof of vaccination to enter a long list of businesses, including restaurants and gyms. So how do health leaders plan to measure the controversial program's success?
We've begged for more concrete data coming back to us that would help guide these decisions. It's something we haven't seen.
8 months after Ian Smith first opened Orange Theory Fitness in Toronto's Fort York neighborhood, he was forced to close his doors. Tomorrow, he and his staff will be enforcing Ontario's vaccine certificate program. He's eager to see the data backing the decision and hopes it could lead to him increasing his gym's capacity, which currently remains at 50%.
Absolutely, we would want more data-driven decisions, because when you're closing your doors and you don't get full reasons why, or here's the with numbers that back that up, it makes it a much more emotionally charged decision to make.
I'm very unclear what the metrics are in terms of how do we know it's working.
Professor Carrie Bowman is a bioethicist from the University of Toronto.
Does all this just evaporate if the numbers get better? I'm not sure it does. I worry that from a social science point of view or a political theory point of view, this is leading to changes within the social fabric of Canadian society that may be somewhat permanent.
CityNews tried to get a clear answer out of Ontario's medical officer of health today.
How are you planning to track whether or not the vaccine certificates are working as a public health measure to reduce spread?
In many ways, in a pandemic, you learn as you go, but to me this is prudent, it's proportionate, it's responsible, it's reasonable, it's cautious, and it will keep our businesses open and keep people who go to those environments safer.
We also asked Toronto's medical officer of health.
There are a lot of different things, measures that are being put into place premised on the evidence as we understand it in our experience, and it is common medical practice, and I would hazard probably social science as well, to implement measures and evaluate and adjust in accordance with what you see.
Neither Toronto nor Ontario's chief medical officers were able to clearly share how they'll measure the success of vaccine certificates' ability to reduce the spread of COVID-19. However, the one metric they're clearly banking on is vaccine uptake.
Looking at the population that has the least protection right now, it's the 20 to 39-year-old population. They have the highest rate of infection. They have still are getting hospitalized as a result of infection. Once it clicks in the coming days that you must be vaccinated to get inside, that will change behaviors.
Now, today, both Dr. Moore and the Premier reiterated that vaccine certificates are temporary. Though with no clear guidance on how they'll measure the effectiveness of the program, Professor Bowman believes it will be hard to judge when it should end. Meanwhile, gym owner Ian Smith and other businesses tell CityNews they're hoping that with everyone vaccinated inside, they'll be able to start to increase their capacity and recoup their losses from a year and a half of rolling shutdowns.